Today we are going to talk about the very important gland in the body called the thyroid gland. The thyroid gland is a highly vascular endocrine gland of the body which is responsible for the metabolism of the body. So, the thyroid gland weighs around 25 gram and it is located in the lower part of the neck, on the side and the front of the neck, and it has two parts, that two lateral lobes and a isthmus which connects the two lateral lobes. So, when we talk about the thyroid gland, we usually talk about the lateral lobe and the isthmus. The lateral lobe has two borders and three surfaces. The three surfaces are the lateral surface, the posterior surface and the medial surface which is underlying the thyroid gland. The thyroid gland has two parts, the two lateral lobes and joined by the pyramidal isthmus. The lateral lobe has a lateral surface, posterior surface and a medial surface. The medial surface is overlying the part of thyroid cartilage and the tracheal rings, and it has two borders, a lateral border and a posterior border. The isthmus has two surfaces, that is the anterior surface and a posterior surface and a superior border and inferior border, and the isthmus is overlying the second to sixth tracheal ring. So, you can see that the trachea is here. So, the isthmus is overlying the second and sixth tracheal rings. Above the thyroid gland, the lateral lobe of the thyroid gland and the isthmus, we can see the strap muscles which are called the superior belly of omohyoid, the thyrohyoid, the sternothyroid and the sternohyoid muscles overlying the lateral lobe of the thyroid, also the isthmus. On the medial side, medial surface of the thyroid gland is related to two rings, that is the two tubes, that is the trachea and the esophagus. Then it is also related to two muscles, that is cricothyroid and a muscle of the pharynx called the inferior constrictor. And then it is also related to two nerves, the recurrent laryngeal and the external laryngeal nerve. The thyroid gland, the lateral lobe of the thyroid gland, the isthmus, will be supplied by three main arteries called the superior thyroid artery, the superior thyroid artery which will supply the apex of the thyroid gland, the inferior thyroid artery which will supply the base of the thyroid gland, and the superior thyroid artery is a branch of external carotid. The inferior thyroid gland is thyroid artery is a branch of the thyrocervical trunk, which is in turn is a branch of the subclavian artery. Then sometimes we also see an artery which supplies the isthmus called the thyroid artery, which is a branch of the aorta, and then we sometimes also see an accessory thyroid artery. The venous drainage, usually the thyroid vein follows the artery. So, the apex will be drained by the superior thyroid vein, middle part will be drained by the middle thyroid vein, and the lower part, that is base, will be drained by the inferior thyroid vein. The superior and inferior thyroid vein will drain into the inferior internal jugular vein, and the middle thyroid vein will be draining into the brachiocephalic vein. Coming to the lymphatic drainage, so you see that the thyroid gland is located here just in front of the trachea. So, the nodes which are lying near the trachea, that is pretracheal and paratracheal, which just in front of the trachea, paratracheal nodes will drain the thyroid gland. Also, you have cervical lymph nodes, which deep cervical lymph nodes also will be draining the thyroid gland. Also, there are some deep cervical lymph nodes also draining the thyroid gland. Nerve supply, the thyroid gland usually is supplied by the recurrent laryngeal nerve and the external laryngeal nerve, and then the sympathetic supply will be by the superior cervical ganglia, which is just lying behind and lateral to the thyroid gland, giving the sympathetic supply. And as far as the applied anatomy is concerned, when there is an enlarged thyroid gland, it is called goiter, and if there is a carcinoma developed in the thyroid gland, it is called thyroid carcinoma, which we usually for that we usually do an FNSC to diagnose, and then we do thyroid surgery called the thyroidectomy. So when we do a thyroidectomy, we should very clear that when there is the superior thyroid artery is very closely related to a nerve called external laryngeal nerve. So when we take off this part of the thyroid gland, we should be very careful with while we ligate the superior thyroid artery. Similarly, on the base of the thyroid gland, the inferior thyroid artery is also very closely related to recurrent laryngeal nerve. So when we take off the thyroid gland, we also have to be very careful of that nerve. The recurrent laryngeal nerve should not be damaged by the when we ligate the inferior thyroid artery.